guys, welcome back to Medical Coding with Blue. Today is Q&A Tuesday. This is the #1 question and answer show about medical coding, airing on Tuesday. Every week I take all of the questions that have been submitted by viewer comments through emails and from Instagram, and I roll it all into one episode to give you guys the #1 question and answer show about medical coding, airing on Tuesday. All right, so I will leave my email address in the description box below, or you can comment below if you would like to have your question answered for a future episode. Thank you to everybody who submitted their questions, and let's get started. All right, first question. Hello, not sure if you can help me with this, but I always hear that you can't have any tabs or anything in your books for testing. Do you know this to be facts? Are we able to add tabs and notes to the ICD-10 CM and CPT book for our testing? So here's the deal. I did ask the viewer, who did not respond to me, by the way. I did ask them which association they were sitting with, because it depends on which association you are sitting with. Now, with the American Health Information Management Association, they are a stickler when it comes to tabbing of the books. I did not use tabs at all when it came to me when I took my certification exam. They were really big back in the day about no use of the tabs at all. Now they say if it came with the original book that you can use it. So with the CPT manual by the AMA, there is tabs there, so you would be able to use those tabs. However, when it comes to like the diagnosis book, I use the ICD-10 CM by Optum 360 coding, and there is no tabs in there. So I wouldn't be able to use the tabs if I had like a separate set of tabs. I wouldn't be able to use that. With the AAPC, the American Academy of Professional Coders, they have a whole thing about tabbing. So they even have somebody who demonstrates it. So it depends on which association you are going with. I would contact the association themselves rather than listening to hearsay, because that I always hear that you can't. You guys have to do your investigating, especially when it comes to something as serious as preparing yourself for your certification exam. If you have loose notes in there, that's a big no-no, and that is with either association. You cannot have any loose papers in your books, period. You run the risk of forfeiting your entire exam fee, okay? And you don't want that. So keep your books as clean as possible. That is my biggest advice, because like I said, for me, when I took my certification exam, my book was clean, all right? And I am really big when it comes to that. I don't like writing in my books. I don't recommend writing in your books at all either, because of the simple fact that when you write in your books, it's like I've seen people who like write, and it's just so much clutter. You're already in a space where you're going to feel the pressure when you're taking the exam. Hopefully you'll be able to work with that, but adding a bunch of like writing and stuff like that, it's just going to be more like just more confusing. I think it just confuses me when I see too much writing, too much kerfuffle on the page is just too much for me. So that would be my advice. Keep your books as clean as possible. If your association allows for tabbing, by all means, if you feel like it works for you, go for it. To me, the tabs get in the way and I end up like taking them off. That's just me. But so anyway, next question. This may be a stupid question, and this is one thing I will say before I get into the rest of it. Don't ever say this is a stupid question, because no, it's not. Do medical coders wear scrubs? Or does the dress code depend on the establishment that you're working at? It depends, because at the facility that I am in currently, we are not allowed to wear scrubs as medical coders. Like, the only ones that can wear scrubs is the healthcare people who have hands-on contact with the patients. They are the only ones. But at the facility that I was at before, they were totally okay with the medical coders wearing scrubs. So I wore scrubs back then. But I will say this. If you are spending time at the facility, if they do not have a dress code, then you need to be dressed professionally. Try to stay away from the scrubs if even if they say it's okay. Yes, I did wear them before, but I see the necessity to be professionally dressed when I'm in the facility at all times. You cannot catch me in jeans anymore. I used to wear jeans way back in the day when I didn't know any better. And now I'm telling you guys, You have to be as professional looking as possible. And it doesn't matter if the other people in your department or in your area are wearing jeans and t-shirts. You don't need to follow the crowd when it comes to this, because how you represent yourself and present yourself in the professional work environment is going to directly affect how you get treated. And if you don't believe me, just try it. Just try it. Try seeing what somebody who gets, how somebody gets treated when they're wearing jeans and a t-shirt, like they're going to go to a rock concert, versus somebody who is professionally dressed. So that is just my advice, and I will always strongly advocate for that, to be well dressed, because you are in a professional work environment. There is no reason to be in jeans and a t-shirt. Next question. You have been extremely helpful. Thank you for sharing your knowledge. I'm looking into doing the classes through AHIMA, and I am so excited. However, I'm a bit confused when it comes to the books. How do I know what books I will need for the corresponding course? Or do I even need books, since this is all online? Thanks in advance. You will need books. You will need books because eventually you're going to have to sit for your certification exam. And you have to have your books with you when you take your certification exam. So you do need the ICD-10-CM diagnosis book. You do need your CPT, or current procedural terminology manual, and that is by the AMA. And you also need a HCPCS HCPCS level 2 book. And then this needs to be all the current year, all right? Depending on when you are starting your program, when you are taking your certification exam. So the program itself should tell you what year, what versions you should be looking at. If it doesn't, just be sure to do your research, find out what you need. Most times they will have a list of the books that you do need, but your main books are your ICD-10-CM, that's your diagnosis book, your CPT manual by the AMA, that is your procedures book, and the HCPCS book, that is the HCPCS level 2 book, and that has all of your durable medical equipment in it, etc., etc. And then if you are learning your inpatient coding, that is the ICD-10 PCS book as well. So if you're only learning the outpatient side, you only need the first 3. If you're learning inpatient, you need that last book. So I will leave a whole list in the description box below on the books that you do need. As far as like the other books that they're trying to teach you with, they'll probably give you a list anyway. Okay, so next question. This is what I'm struggling with looking for a job. Somebody had commented that on a video. And then another viewer commented, with or without a degree/certificate. I was thinking about getting a certificate, but if no job, then maybe not. Here's the thing. Medical coding is not easy to get into right away. This is something that I say a lot. But there are people that have self-serving reasons when they're selling these programs that will tell you all of the great and wonderful things about medical coding, except for that you have to try very hard in the beginning to get a job. Is it impossible? No, because all of us started with no experience, but we had to really apply and apply and apply and apply. There are many reasons why people have a difficult time in the beginning. There are many reasons for the process to be slow in the beginning. Experience plays a big part of it. Obviously, if you have no experience and you're just starting out, how are you presenting yourself with your resume and your cover letter? If your resume and cover letter look boilerplate like everybody else's, then you are going to get passed over. You have to put yourself into this resume. You have to make sure that your resume looks good and has all of the information on there that is in that job listing, right, that pertains to you. Like if you know your anatomy, physiology, and medical terminology, you need to put that on there, because you can't assume that the employer knows that you know that because you just got done with the school. Okay, so that is something you have to be aware of. You have to be able to pass a background check and a drug screen, and you have to be able to pass their assessment test, because they will test you to see where your coding skills are. A lot of people who are brand new and have had no experience run into the issue of, well, you don't have any experience, get experience and come back to us. You can apply at a temporary agency. That was how I got my start. It was a temporary agency that specialized in healthcare professions, medical coding being one of them. And that was how I finally got my foot in the door. It took me a couple months, but I finally did it. But a lot of people will get discouraged. And after a few times where they get rejected or turned down, oh, I'm not going to do this anymore. So there's a lot of talent that gets wasted. There's a lot of money that gets wasted, especially if you went out of pocket to find a job. And the areas are going to be different too. If you're in a big city, obviously you're going to run a better chance of finding a job versus somebody that's in a smaller town. It doesn't mean that there are no positions in a smaller town. It just means that it's going to be a little bit more of a challenge and you may have to branch out a little bit. So there's those things. If the job listing says we need 3 to 5 years experience, you still apply anyway, because you have to get your name out there. Sometimes if there's not qualified candidates to apply, they will take a chance on somebody new, but you have to put yourself out there. And if your attitude in the beginning is, well, that they were thinking about getting a certificate, but if no job, then maybe not, then it's probably not the profession for you, because this is not an easy field to get into. But once you do get in, it is very rewarding. But there's people out there that are not patient enough and they want whatever they want and they want it right now. This is going to take time and finesse to get in. Okay, so I'm just letting you guys know that up front. Next question. Do you have to remember every single code, including the subcodes, or just remembering groups of diseases and what code category they belong to? No, you do not have to memorize specific codes. The code recall will come to you after a while once you started working in the field. Yes, you do need to kind of know like what the categories are, like your signs and symptoms are your R codes, your your orthopedic codes are going to fall under the M codes, that kind of thing. Injury codes are going to be your S codes and things like that. That would be helpful for you to know. But as far as knowing specific codes, no, you don't have to, because they update and they change every year. And you never want to be coding off of memory, because if there's a more specific code that you can find, you need to code to the highest level of specificity rather than just, oh, I just remembered this code, so this is close enough, I'm going to put this. No, it has to be as specific as possible. So, next question. I am currently working in a government hospital in Qatar since 2008, or 8 years, 8 years ago, as a registration clerk, and my academic qualification is secondary high school only. I am proficient in desktop operation. Am I eligible to become a medical coder? Anybody can be a medical coder. All you need is a high school diploma or a GED. So if you've had experience working in registration, that's not really going to help you when it comes to saying that you have experience in coding, but it just know that all you need to start is a high school diploma or a GED. So absolutely, you are able to study that if you wish. Next question. We are supposed to interview someone. Okay, we are supposed to interview someone currently in the field, but I don't know anyone personally. So I was hoping that you would be my interviewee. I have attached the copy of the assignment with the questions in a couple of different formats for your review. It could be a fun idea for a video. The assignment is due this Saturday, 12/26, right? December 26th. And I got this on December 22nd. So let's talk about this for a minute. December 22nd. Now, keep in mind, I have my channel here, the main channel, my YouTube channel, Medical Coding with Bleu. Then I also have Patreon, my Patreon channel. And Patreon, if you don't know, is a lot like YouTube, except for people pay to sponsor the creator, which would be me. So I have a huge responsibility to these folks who are paying me to teach them, to talk to them, to basically share my knowledge with them. And I share my time equally as I can. I also was doing Vlogmas at that time. Not to mention, you're in the middle of the holidays. You gave me this, you sent me this email 4 days before you have this assignment due. So first of all, that's not fair. Okay, let's be fair here. If you need a favor like this, and if you need an interview or whatever, I know that you've had to have had this assignment way beforehand. Guys, please be considerate of my time as well. When you're asking for a favor, don't expect for this favor to be returned if it's with a short window like this. And in the list of questions, they wanted 3 to 5 sentences for these answers. So again, I'm sitting here having to look at like 5 questions with 3 to 5 sentences each. No, guys, no, I'm not going to do that. And it's not because I don't want to help you. It's because a lot of these questions I've already answered in advice videos that I have tons of advice videos. How I got my start in medical coding, it's all here. If you are needing to get an assignment done, you can actually look through any of my videos and see where I've answered these questions before, because I tried to be as specific as I possibly can in the titles of my videos. And if you need a specific topic, just write me and say, have you done a video about this? And then I can just point you to the correct video, and that's totally fine. But let's be fair here, guys, all right? If you're going to ask questions, I welcome questions all the time, but please don't put me under a tight deadline like this and expect me to respond, because that's not fair, right? And I have my own life outside of all of this, because I still work a full-time job. I have the 2 channels, and then I was doing Vlogmas at the time. Plus, I was taking care of all the other things that I need to take care of for myself. So again, I don't mind your questions. I am happy to help, but please, let's be fair on these timelines, all right? And that's all I'm going to say about that. Next question. What is the male ratio for the RHIT or RHIA job? I see that there's more females involved. I feel like if I graduate and apply online, employers will most likely get a female. So I'm going to be filming an episode about this for Monday, which would be yesterday when you guys see this video, because I'm filming these ahead of time. I don't have the specific numbers when it comes to males in the field that have degrees versus females. Obviously, we all know that females dominate in this industry because it is just the way that it's always been. But the fact that there's males out there that want to be medical coders, I think is a great thing. And I think that any male who wants to be an RHIT and RHIA, these are the managerial type positions. Know that if you are getting into this industry, that you have just as much chance as a female if you're going in based on your education. So don't let the fact that you're a male stop you. Don't let your gender stop you, because that's in 2020, in the year of 2020, this is not something to be concerned with still, right? But know that you're probably going to be in the minority. You will be working around a lot of females. But keep in mind that you're still working in the medical environment. So there's lots of other males around. They're just in different positions. But again, I go into it more in Monday's episode because it's going to be advised totally to male medical coders, or the ones who want to be males who want to be a medical coder or in the health information field. So I will leave the link for that video in the description box if you hadn't had a chance to see it. But yes, if you are a male and you want to do this, go for it. Don't let the fact that there's so many women stop you from doing this field. I'm just saying. Next question. Hello, ma'am. I am a student in health informatics and I have an experience of outpatient medical coding for 3 years. What should I do after my master's in health informatics? Here's my question. What was your original plan when you got into this master's degree program? What was your original plan? Because I think that if you're spending that much money on education, that you get a master's degree, you need to have some sort of plan as to what you're going to do. Obviously, you either want to be in the managerial side of the house or you want to be an instructor. There's either way. Because if you try to go and be just a regular medical coder, they're going to try to put you in a managerial type position because you have your master's. If you end up with your RHIA, it is very rare that I see a RHIA that is just a medical coder. They always want them in some sort of managerial function. So if you are in this boat and you don't know what to do, you need to have a plan before you start investing all this money into your education. It's great to get a master's degree. That's wonderful. But what are you going to do with it? I mean, there's so much that you can do. You can run entire hospitals. You can run whole departments. You can teach. And if that's what you want to do, I mean, that's what I would do. If I had that, I absolutely would teach. I absolutely would be running a whole department in a hospital. That would be what I would do. But that's just my advice. And the last question. The test is expensive, and that's why I never had a chance to take the CPB, the Certified Professional Biller, and that is offered with the American Academy of Professional Coders. I have billing experience. I don't really know if I want to take it. Many people fail for that price. Here's the thing. Health information is an expensive field. It's an expensive field to keep up your credential. It's an expensive field just to get your credential. To maintain your credential, there's your continuing education units that you have to pay for out of pocket if you are not in a place that gives them out for free. Okay, that's number one. Number two, you do not have to be certified to be a biller. You do have to be certified to be a medical coder. Now, I always tell people you don't need to apply for the CPB. If you're going to be a biller, be a biller. Because if you look in the listings, the job listings for a biller, they're not looking for anybody to have certifications. What they're looking for is for you to have had experience, or if you don't have experience, that you know your anatomy, physiology, and medical terminology. That's what they want for people who do the billing. Because essentially all they're doing is processing the paperwork. Does it help if they know their medical terminology and all this stuff? Yes, it does, because they're having to look at these things as well. So with that in mind, to get a CPB, you are essentially getting a credential that you don't. Some people get it because they have their own business. Okay. But if you are wanting just to work for somebody and you just want to be a biller, you don't have to be certified. You already have experience. You can go and get a position without having to get a certification. So don't make yourself have to spend out more money than you don't need to. If you want to be a medical coder, that's something different, because then, yes, you will want to get a credential for that. You will want to get a CCA, a CCS, or a CPC. You'll want to go with one of those routes because that's what you're going to need in order to become a medical coder. But if you're just going to be a biller, you do not have to be certified to be a medical biller. So I'm going to wrap it up. But that is all the questions that I have for this week. Thank you so much for joining me. And again, if you have any questions that you would like to submit for next Q&A Tuesday, please comment below. And I will see y'all next time. Bye.